Questions from module 122 on cements. A lot of stuff.
There's a lot of stuff.
We go back through kind of the history of cements, the evolution of the glass ionomers, the evolution of the polycarboxylates, and the zinc phosphates, which the zinc phosphate you'll probably never use. And yet, when Dr. Thorell and I went through school, I mean, it was standard. It was the best permanent, if you will, cement that we could use. It had a high compressive strength. It was prone to create a little bit of sensitivity because of its acidity that usually calmed down within a day or two, but it was, you'd say to the patient, this tooth may be a little bit sensitive for a few days to like temperature change and that kind of thing. And again, usually it would calm down, but it's because of the acidic nature, it's phosphoric acid that's used in making the zinc phosphate cement. And it was very technique sensitive. I think there was a link in the lecture there in the, on the PowerPoint that you could go to, there was a YouTube video on mixing zinc phosphate cement. You divide the powder, literally, and I can kind of show you with this. We're not going to mix any today. We could. If anybody wants to mix it, let me know. But you would take the powder, you always mix it on a chilled glass slab. So at least a glass slab and chilled if possible, because it slows the reaction down a little bit. And so you would add your powder. This is really taking a time, but you'd measure it out. Oh, come on here. I don't think these things have even been opened up for a long time. So you'd measure out your powder. Not like I'm doing here. And then you'd measure out your liquid, and you would take your powder and divide it into at least 6 equal parts. So you take it and you do that, and then you do that, and that, that, and then you dispense your liquid next to it, and then you would start mixing over the course of 2 to 3 minutes. So you put the powder in, spreading it out across the glass slab to keep it cool, but do it incrementally. So if you add all the powder in at once, it'll set almost like that. It slows the set down if you mix the zinc phosphate incrementally. Again, I'm not going to go into a lot of detail with zinc phosphate. It's interesting from an historical perspective. The major downside, besides the postoperative sensitivity to zinc phosphate, you remember what it was?
Irritation of the pulp.
Well, it would do that because of the acidity, absolutely. What was it?
Does it dissolve?
Yes, solubility. You're absolutely right. And that's one of the reasons that tight margins were so absolutely critical with some of these materials. That's why clinicians and labs got so good at tightening down gold margins, and down to 10 microns. And those still are the very best margins in dentistry, are cast gold, where everything has been calibrated along the way, every single step, and a lab that is good at that process, their water-powder ratio, not only with the mixing of the stone, but the investment, which is the mold that the wax up goes into, the wax pattern, were all calibrated. So that product that dropped out the other end after 6 or 8 or 10 steps, it's really remarkable when you think about it. You'd go back to the tooth now, and this thing would just sit right down in place with really quite smooth margins. The other thing that added to the ability of the clinician to have nice, smooth, and closed margins is gold margins, especially high noble gold, with super gingival margins, like in an onlay, can be finished on the tooth post-cementation. And there's a technique involved in doing that, but the material is soft enough that you actually burnish it against the tooth as you do it. And so those kinds of restorations, I know Dr. Janis has got some gold work in his mouth that's, what, 60, 65 years now? That's pretty good. Try getting a car tires or anything else that is used like a tooth or teeth or restorations to last that long. That's remarkable. It really is. And I have gold that's probably 20 plus years old, and it's cemented with one of the newer cements, but it still has nice, smooth margins like we like to get with that. And so, in a way, we had to be a little bit more exacting in those days because our materials, our cement materials, were not quite up to a point where they are today. Now that doesn't give us a license to get sloppy with margins, but that is a factor. As we go toward the resin cements, they're less soluble. That's another thing. If I put this, let's put this over here. This is polycarboxylate. Tylock Plus is the brand we use. There's several different brands. This, again, the chemistry is similar between these two, but different. And the evolution of these two cements started with the silicate cements. They developed into the glass ionomers, the zinc phosphate, and then the zinc polycarboxylate, okay? So the zinc polycarboxylate is really nice because it's so easy to mix. You don't have to go through this long drawn out process like you do with zinc phosphate. You still want to mix it on a glass slab. So with polycarboxylate, and you'll use this occasionally in the clinic, not for a final cement, although that was its original intention. One of the things we found with this was used a lot in the 70s and 80s, but about 10 years in, these crowns would come off because the cement would dissolve. And so we realized this is not a good long-term cement, again, because of solubility. It's just much more soluble than the resin-based cements. But this is a nice cement for holding on a temporary, maybe, that doesn't have much resistance and retention form. The nice thing about this is it's liquid. It's just distilled water. Yes.
So if it was originally designed to be like a real permanent cement,
Yeah.
and you use it in a temporary, how hard is that to get the temporary off? Is
Harder.
it pretty?
Yeah.
Is it pretty stuck?
And there's a weak bond to the tooth structure. So when you take the temporary off, where's the cement? It's on the tooth. And so you have to plan on getting that off, and it's a bugger to scrape off with like a scaler, but with a sonic or ultrasonic scaler, you can pop it off in no time at all and get it off the tooth or off the tooth structure. But that's a great question, and so you've got to be careful when you use it. And one of the applications, we'll get into this next semester, you're going to learn about a cast post and core. The temporaries for the cast post and core are best cemented with Tylock. But you only put it around the margin. If you put it down the post, you'll never get it out. Because there's a post involved with that temporary. So you keep it off the post, just around the margins, and that's how you deal with that strength factor, is you don't put it everywhere. And they come off quite nicely. This is do you remember in the lecture we talked about consistency, how viscous is your cement when you're all done mixing it? With the paste formulations, like is so much the case now with these clickers and the syringe delivery auto mix, which is the case with the resin-based cements, the consistency's consistent. If you get what I mean, the viscosity is consistent because it's paste, and you're not making it more or less viscous in nature. With powdered liquid formulations, can you see how the viscosity can vary? More powder, more viscous. More water, less viscous. And so, you remember we talked about testing the viscosity, and what was the test? Kind of a crude test, but it works pretty good.
1-inch rate test.
1-inch snap off, exactly. So, you've got the powder for your tie lock. That doesn't have a top on it. We use this so infrequently. Ah, there is water in that one. Okay. So, invert your bottle, 2 or 3 drops of water, depending upon how much you want. And then you'll mix this by just bringing the powder into the liquid. Again, this one it's not real critical how it's mixed in terms of proportions. And you don't want to mix this on a paper mixing pad like we have, because what does the paper do? Even though it's got a glossy side to it, make sure the paper soaks up all the moisture, and so these dry out on you. So I've added some of the powder. Make sure you get all of the powder incorporated, or you'll have chunks in your cement, and whatever you're seeding won't seed all the way. So I'm not getting an inch, am I? Bunch it up. It's not an inch, so we're going to add more.
Do they have Duralon at all?
No, and see, that's about an inch snap off. See that?
Yeah.
Before it snaps off. That's about an inch. So that's the right consistency now. If I was gonna cement a temporary, I could take that and just go around the margins with it. Or if it was really non-retentive, I could wipe it through it and then cement it. Duralon is the exact, it's Premier's brand of tie lock. This is called Densiply. And what Dr. Thorell was asking about is, okay, do we have Duralon? Is that one that's available clinically? It's not. They're basically the same cement, but Duralon's liquid is part of the chemistry. It's thicker, it's kind of viscous. And as it sits on the shelf, it gets thicker and thicker and thicker until you can't use it, and it changes the viscosity of, well, you know, the cement that you're using. That's why we prefer the tie lock, because you're just mixing it with distilled water. And so this has almost an indefinite shelf life because of that. So that's one nice thing about it. Now, when you've got it to this point, you want to clean it up, because if you let it sit on the glass slab or this, you know, you won't get it off. So if somebody will grab me, you know, a tissue, a towel, or 2x2 sponge or something, we'll clean this off, and then I'll let somebody maybe wash it off into the sink, because it is water soluble. So we'll get rid of that, and then if somebody will take and just wash that for me, and I'll give you this too to kind of scrub it with. Thank you. So that's tie lock, and you will use tie lock from time to time. Tie lock is used for, again, cast post and core temporaries. It's also occasionally used for ceramic onlay temporaries. So we're gonna do those spring semester, but ceramic onlays are basically, they rely on bonding. They don't rely on resistance and retention form. In fact, we over taper them intentionally. In the realm of 20 degrees, you know, 15 to 20 degree taper rather than 6 to 10. So your temporaries don't stay on very well. So you either have to use unfilled resin, so it's just basically flowable composite. So flowable composite without any bonding, you just add that to the underneath side of your bisacryl temporary to a clean tooth surface, clean, dry, Then you add the flowable composite, cure it, put it on the tooth, get rid of clean up the excess, and then cure it. There's no bonding taking place, but because that flowable composite now is so tightly approximated to the tooth structure, they stay on quite well. And that material is obviously a lot stronger than the temporary cement. So usually a temporary cement is not strong enough for an onlay, a ceramic onlay temporary. That's why we'll use either Tylock. Downside is you'll probably need an ultrasonic scaler to get it off the tooth. If you use a flowable composite as the bonding, or the cement, not the bonding, but the cement for a ceramic onlay temporary, what does the flowable composite stick to when you take the temporary off? What's the chemistry of integrity, or the bisacryls? What's it made from?
Resin.
Acrylic and bis GMA resin. So it's resin-based partially. So because of the resin component of the temporaries that we use, the temporary material, the flowable composite will bond to that, and when you take it off, you've got a clean tooth. It did not bond to the tooth. Now, if you really have rotten retention with your onlay preparation, you can spot etch, and we'll talk about that more when we do those, and in that case, you will get a bond where you've etched to the tooth structure. But you don't want to use a dentin bonding agent. You'll get way too much resistance, and you get too much retention in that case. So that's basically the permanent cements of the old class, and now we get into the resin-based cements. So the ones that you're going to be using mostly are, and these are 3M's brands, 3M SB, is Reliax Luting Plus, which is a resin-modified glass ionomer. So it's resin-based, but it's been combined with glass ionomer. Now, why would they do that?
Fluoride.
Fluoride release over time.
Fluoride release, so sustained fluoride release. Any other?
Bonds better to the tooth.
You don't get any better bonding, but this is kind of my go-to. When I'm cementing zirconia crowns now, because of the fluoride in them, I'll use Reliax Luting Plus. Now, you can use Reliax Unisem, which is a self-adhesive resin cement. So it's all resin. It's self-adhesive because, remember, the phosphoric acid is built into the resin. So when you mix it and then put it onto the tooth, it's actually etching the dentin and enamel, if there's any enamel left, during the first 30 to 40 seconds. And then as the reaction takes place and it polymerizes, it neutralizes the phosphoric acid, and so it doesn't linger with the acidity. Both of these work very nicely, and both are quite low in solubility. If you had to choose between the two in terms of solubility, the Reliax Unisem, being totally resin, is the least soluble. But Reliax Luting Plus, with a small glass ionomer component, is not very soluble by comparison. Glass ionomer, however, is more soluble than all the other resins. Okay, so if we were to look at solubility, polycarboxylate is probably the most soluble, followed by zinc phosphate, followed by glass ionomer, followed by resin after that. Okay. So these are, again, because these are a paste, they mix easily. If somebody wants to practice with this, let's dispense a little. This is a clicker, and so and this one may be getting a little old because we only use this about once a year upstairs. But you click to dispense. Oh, we got a plugged barrel. See that? So that's because, again, these are not used very often. Does somebody have either the end of a perio probe or something like that, or an Explorer will work, anything along those lines. If you ever use something like that to unplug one of these, you want to be really careful not to leave any cement residue on your instrument.
Got it, Taylor.
Oh, thank you very much. Yep, that should work. So we'll just getting a little gummy, a little old. Usually you'll get just a nice little dispense of both these. Somebody have something I can wipe this with? So let's see if that's gonna give us a little. Okay, we're gonna force this one. There, it's coming. See, this is drying out, getting too old. It should be, that's too viscous. It's just, so let's try this. That's better. There we go. Now we're starting to get down to some flowing resin. If you have a resin that's gone past its expiration date, thank you, and starting to notice how that one, I mean, that's too thick. You never want to cement anything with that because you can tell this is too thick already. There's just no way that you could. So, and if we look at the date, it's probably an embarrassingly old.
December 14th, 2021.
'06, back in '06. No, I'm teasing. I'm teasing. I'm teasing. All right. Well, 2020, not that long ago. So October 28th of 2020. Yeah, it's not that bad, but you can see, I mean, they do go past their date, and it should be equal amounts of that. Make sure you put the clicker back on right away. And if somebody wants to, again, it's gonna be too thick, but you're welcome to experiment with that. Now, let me just show you on the mixing. Let me show you one, I'm gonna have you do one. Both of these resin-based cements need to be mixed a minimum of 20 seconds rapidly. So your assistant should grab those. So rapid mixing, and usually you're gonna have twice as much as I'm using. Then gather it up. So again, twice as much as that. Go 20 seconds, and then again, you're gonna have twice that amount. That's half as much as you need for a crown. Hold your crown upside down. Just wipe it into it so the entire amount goes down inside the crown. Spread it to the margins, and then you've got a clean, dry tooth, not over dry. Not over dry, don't desiccate with these. You just take the sheen off so there's no puddles anywhere on your tooth, and then put it into place. Make sure it seats fully. Check, you've got good cotton roll isolation. Check by having the patient bite and give you some feedback. You know, you've tried it in, you've adjusted it if necessary. It goes to place, and when they close together, it should feel just like it feels when the crown isn't in there, in terms of it doesn't alter the bite, it doesn't make anything change, it doesn't make it. This is a good one to ask patients. Do you feel like you have to force the opposite side of your mouth together? Because sometimes they can be so close that, well, yeah, I think it's okay. Oh yeah, but if I squeeze hard, then this side touches more. Well, you probably don't have it seated all the way, or you didn't adjust it properly, or something like that. So it's important that it seats all the way. Only then can you have them close on a cotton roll, squeeze hard, hold it, check it one more time to make sure that didn't cause it to shift, then put the cotton roll back in, close, hold for at least 2 to 3 minutes. So it doesn't move around at all while it's in that setting phase. But what can happen, especially with milled zirconia crowns where the internal aspect is not quite as accurate as a casting, like a cast gold crown or a PFM crown, they're better adapted. Milled crowns that are milled from the inside are a little wobbly sometimes. And so the cement really becomes an important component there, that it's got a good compressive strength, and that it is not very soluble, okay? But what can happen is it can actually move a little bit. It'll shift when they bite down on it. And then you go, you look in there and you go to clean it up, well, it's high, it has an open proximal contact, something's happened. You don't want that. So check, double check when you put it in, then you can put the cotton roll in again. Watch that it doesn't change at all, that your zirconia crown does not shift or move when they're biting pressure on it. Does that make sense? So let's do a second mix there. And again, make sure that your assistants mix for a full 20 seconds on this. Sometimes you'll get both base and catalyst fully incorporated. Would somebody wash that off with a little water, get the rest of that off with a fingernail and whatever it takes. The streakiness, the materials have a little different color out of the two barrels. The streakiness can be gone in 10 to 15 seconds easily. But if they haven't mixed it quickly and thoroughly, that whole 20 seconds, sometimes you don't get complete polymerization. So you definitely want to agitate it well, mix it well, 20 plus seconds. Don't go too long over that or you'll start to set on you. Dr. Thorell, have you ever had cement start to set by the time you were inserting the crown? That for whatever reason, the assistant took a little long or whatever happened, and as you were inserting it, you felt like, this is not seating. Have you ever had that happen?
Oh, of course. Especially with zinc phosphate. If they,
Yes.
Yeah.
It happens, doesn't it? And so if that were to happen, what do? The cement's too viscous, you realize it, you've inserted it, it's not seating all the way, what are you gonna do? Abort!
Yeah.
Get it off and get it off quickly or you won't get it off. And then it's really a pain in the hind end because you gotta clean off the tooth well, you gotta clean out the inside well, the intaglio. Try it in again, make sure there's no little chunks of cement anywhere that are gonna interfere, and then go through the process again. But if it happens and it's not going down all the way, just stop, back up, yeah, take it off. Don't try to push it into place because it won't go. So let's put out another little bit here for you to practice with. It'd be interesting to see if this one's gonna come out, both barrels. This is the Unisem. Look at that. What's the date on that one? Whew, this is even better.
December 12th, 2018.
Keep going. This is 2016. Yeah, March of 2016. So.
Yeah, the first graduating class I didn't graduate.
Yeah, oh yeah, and see one of these barrels is completely set. So we won't be able to try the Reliax Unisem, but we will be able to put these in a museum. And this is what it looks like.
Wow.
So, there's a couple of things in dentistry that the date on them truly means the date on them. One is anesthetic. Boy, anesthetic, I mean, a month or two after its expiration date, you're shooting blanks, literally. It typically will not work. And then cements, resins can be that way. Cements, bisacryls can be that way. The biggest problem with a bisacryl going beyond its shelf life is not so much that it won't set, but it gets discolored. They darken. They don't look very good, so you gotta be careful that way. But these cements, you definitely wanna use them within their shelf life.
Just make sure your assistants put the lid back on right after.
Oh, yes.
You don't want them sitting out.
Exactly, yeah. Sitting there on the bracket table like that, the one side of light cure. Thank you. That did take a while. We got it on there. Thank you. Yeah, good job. Don't ever use anything sharper than your fingernail to clean these off with. You know, metal objects will actually
Good thing I only use my finger.
yeah, will actually scratch the surface of these.
He was using his pocket knife.
Yeah. There we go. Yeah, and so what's the problem? Also, you've got to get the edges of these really clean. So not only the flat spots, but the edge. And that's okay, but so what is the problem with leaving little chunks?
If it breaks off, it'll break off in the cement.
What did I hear?
I said if it breaks off, it'll break off in your cement.
You got a boulder
Yeah.
in your concrete. And now you got to seat whatever it is you're seating, and the boulder's going to get in the way. You're exactly right. So clean off your spatulas on all 4 sides, 3 sides, whatever, 1, 2, 3, 4, 5 sides, right? Plus the end. Okay. So we won't be able to use Relax Unison, but you can practice with, if you want to.
That's gonna be a test question. How many sides?
Yeah, how many
5 sides.
Yeah, you think I am really nitpicky, don't you? Okay, let's see here.
Should we have them race?
Yeah, okay, here we go. I'm gonna do it double because that's really how much you'll mix.
My hand.
Here you go. So,
Go.
show us how to
Oh, boy.
mix
Emma,
that.
I get,
Go.
Go, Emma, go, go, go.
come on, Emma.
Oh, she
Go,
knows
go.
how to do this.
So 20 seconds, rapid.
She knows how to do this.
Yeah, she's going really
She's
good.
all over.
Rapid,
It's
Emma.
almost like her advantage.
Yeah, it's almost like, yeah,
It's almost like she knows.
that's crazy.
Yeah. Unfair advantage.
Good job.
Yeah, now gather it all up, just like you're gonna insert it into a crown now. And if I had an old
Don't-
temporary, yep.
Has anyone
So-
done this yet?
Then again, crown
Really?
upside down. You take this just along the side of it, so that the inside, the edge, the margin picks up everything. Spread it to the margins and it's ready to insert, okay? So that's basically it, nicely done. And that isn't really a bad consistency for that stuff being, see, look at that, it's just a little thick.
Test.
Yeah, it's about 1.5 inches, so
Emma's-
Emma did something to that old stuff. It'd be interesting to see if that sets. Let's see if that sets on us. Here, let's clean
Give it
that
more
up quickly.
Uh-oh.
We better clean that
Emma
up on
was
the quick.
clapping for herself. You notice that?
That's, yep.
So any questions with any of the kind of the permanent cements? Now, one that I didn't, this is the only example of it that we have, but we have a whole set of, this one's called Calibra, and this is an aesthetic resin cement. So it's used for veneers, it's used for ceramic onlays. You can use it for crowns if the crowns are a little bit translucent. If they're not, I would stay away from this. This can be, thank you, this can be, so the aesthetic resin cements can be used in light cure only mode or chemical cure only mode, although we seldom do that anymore, or dual cure mode. And that's the most common. So your buildups are a dual cure. That means they can be light activated, but they will also, once mixed, the chemical reaction will take place without the light. With every light cure cement, with every dual cure cement, so these are both dual cure. So it's base catalyst, mix it, insert it, it will set on its own, chemically. With every one of those that is a chemical set, dual cure, if you light cure 2 when you're all done, you will further polymerize the material and strengthen it. So even crowns that are cemented with either one of these, because it's dual cure, there is a light cure component. You can mix it and hit it with light and it hardens just like that. But obviously cementing a crown, you don't want to do that. You want time to work with it. So you get it into place, and I like to just let them chemically set for several minutes and then come back, clean up the excess, and then hit it with the light for everything at the margins. Even if I have an opaque, zirconia crown that doesn't let much light in, I'm gonna at least get some light in there, and it will further polymerize and strengthen the material. So all of these, good idea. If there's a light cure component, utilize it and you'll get better curing. Back to the aesthetic resin cements, they can either be, so if you're doing veneers, for instance, base only, that's all you want. You want light cure only, because you can get light everywhere, okay? If it's a ceramic onlay in the back part of the mouth, you want to add the catalyst to it so it's dual cure in nature. Does that make sense? Because the light may not get into some of the far recesses of those preparations in the back of the mouth. Some of the ceramic onlays can be rather thick in places. And so if you add the catalyst and mix, so now it's dual cure, and do your cementation, get it in place. It's gonna chemically set on its own within a minute or 2 or 3. Clean up the excess, hit it with the light. You'll further polymerize it, but if there was any of that material that the light couldn't penetrate to, because you mixed the catalyst in, that will cure all the way, okay? That's the difference between cementing veneers and cementing onlays with the aesthetic resin cement is you want to add the catalyst if it's in the back of the mouth. But that's what this is. This is just the translucent version of their aesthetic resin cement. And like it says there, it says dual cure on it. That means either light or chemical or both, right? Dual cure.
You can,
So those are pretty much, you know, those are the final cements. Temporary cements, well, before we go to temporary cements, IRM is another material that you will use. Has anyone worked with IRM before as a dental assistant or in any?
where, is Chris here? She's the best.
Oh, yeah, she'd be awesome at that.
She
I don't
is
know
the
whether she's
best
still
at-
here.
Doesn't look like it.
IRM is another material that you want to use on a glass slab. And the nice, so intermediate restorative material, IRM, it was actually used and developed, I think, by the military. And they had a color coding system. So if kind of out there in the boonies, there was a temporary filling that was put in, they had a red version of this that meant there was a pulp exposure and it needed endo. So once they got back to where they had access to good dental care, that red IRM was a signal to the dentist, well, this is gonna need a root canal before we do anything. I think they had a blue and a white, I'm not sure. Joel, are you familiar with, or Ken, with the rest
White
of the
and
colors?
red, I don't remember.
Yeah, at least white and red anyway. IRM is something that when you mix it, and this is a big deal, you want it like dough, like you would get like bread dough. Either a packet like this. This is temp bond. It has eugenol in it. You remember what eugenol does to the tooth?
Soothes the pulp.
Yeah, it's an obtundant. It kind of calms it down. For that reason, it really is kind of nice. Now, eugenol can interfere with your bond strength if you're bonding something. You've got to be aware of that. It's most critical within the first week. A temporary that's been on more than a week, usually the eugenol is not going to be a problem with the bond strength. But if you have a temporary that's just on for a day or two with eugenol in it, and then you go to bond after, you may have some degradation of the bond strength. But paste, easy to mix, you just incorporate both. Again, I like to not, you know, if I'm cementing a final crown, I load it up. If I'm cementing a temporary crown, I often just put it around the margins, or not a ton, because it just, I gotta clean it all up. And I want it sealed at the margins, and I want enough to hold it in place, but I don't wanna make a big mess either. There's also, this is just a syringe form of the temp bond, that, and it's the same basic chemical reaction as with the IRM, but this has little polymers in it, like little fibers, the IRM does, that cause it, it just makes it harder when it's all, you know, when it's all set. Whereas with temp bond, you don't have that, but they're both eugenol based. And then there's no non-eugenol based temporary cements too. Same idea, but no eugenol for obvious reasons, especially if you're bonding. If you have an endodontically treated tooth, eugenol is a little messier to clean up. It's kind of nice to use a non-eugenol, but if you have a vital tooth, I mean, don't you think, Dr. Thorell, that it's nice to have eugenol in there?
Yes.
It's just
Eugenol's
happier
very
patients.
good.
Happier
Yes.
patients, yeah. I would agree. So we'll come back to this next week with the whole class and do IRM so that you all kind of get the consistency of IRM and see how it's mixed, because that's really important. If the IRM is not mixed thick enough, it doesn't set well, it's sticky, it's messy, and it's just no fun to work with. If it's mixed right, ain't it great? It works really well. Anything you'd add, Dr. Swilling, Dr. Janis, Dr. Thorell?
We all loved the Duralon or the Tilex when it first came out.
Yeah.
Till our crowns started falling off.
Exactly, exactly.
Because it was so kind to the
Yeah.
tooth. It wasn't sensitive at all. We thought
We've
we
been-
had the perfect cement.
I know, we've been through several waves of cements. Remember there was the polycarboxylate wave with Tylock and Duralon?
Yeah.
Followed by the glass ionomer wave, purely glass ionomer wave, and a lot of sensitive, pulpily damaged teeth
Yeah.
that needed root canals. And now the glass ionomers are a lot better, less likely to induce sensitivity, and the resin modified glass ionomers, I think that's where it's at. That's really a good combination, and you don't get the sensitivity with them, so. Okay, we'll pick up where we left off next time.